Yeah, my name is John Brink. I'm from Victoria, British Columbia. About 15 years ago, I fell on my knee from about 4 feet high and did damage to my right knee. Gradually, the knee became more and more of an issue and became more and more limiting. For me, it was a question. I had to make a choice, either gradually see it get worse or otherwise do something about it. And we did a lot of research, and to make that decision, it being the most important joint in your body, it was extremely important as far as I'm concerned, and we were concerned that we made the right decision, because I cannot afford to make the mistake. Now we have another issue that is somewhat different from being in the United States. Is I'm from Canada, and in Canada, we have universal health care, which means that this is considered to be elective surgery, and there is a waiting period that could be as much as 12 to 18 months. Suffice to say that at 75, I don't have the liberty really of 12 to 18 months, and I felt it was sufficiently important that the cost of doing it outweighed the waiting process, and we knew between my doc and myself that at some point I would have to make a decision as to what to do. So it probably was, I would think about 6 months ago, probably 6 months ago, that we said, okay, let's take the first step. The first one was to connect with one of the best surgeons that specialized in this area, in the Vancouver area. He did a consultation and then did x-rays and MRIs, and then about 2 weeks later had a consulting session with me, and basically said, there is no option to doing a partial. It's a replacement that you require. And that then being said, what needs to be done, we cannot do that in the clinic that they have. They can only do partials, and so you have to then get in the queue, and it likely will take 12 to 18 months. We knew we were not going to do that, and so we started to already look for other options. Maybe, if you look at the internet, you can look at India, you can look at Thailand, you can look all over the place. And increasingly we became more and more focused on the United States, and in particular we found out more and more about Dr. Kassman. I believe that if more was known and more the public was aware of it, especially seeing testimonials and then seeing people. The one in particular that impressed me was a fellow that was not sure if he should get one replacement. This was in the States. This was not even to do with, should I stay there or should I already was past that. So for me it was a question of who and how confident do I feel about the facility. And this particular individual initially was going to do one at the time. Then he had to consult, then he chose to do both at the same time. And then within 12 days, he was walking without a stick. And this was, to me, so absolutely unbelievable. So we came actually on Tuesday, and then had the opera, just to kind of climatize a little bit. We spent Wednesday for a down day. We had a meeting, our initial meeting with Dr. Kassman was on Wednesday afternoon. Then, we checked into the hospital, I believe, at 11 from there, and then went fairly quickly. The interesting part about it was that, the first evening I already walked without a cane after an hour and a half, so up and down the aisle, and felt quite comfortable. I worked with Scott, who comes down every day, spends about an hour with me, gives us specific instructions, so I work with the physiotherapist about an hour a day, and then he gives us some coaching material, so we spend probably another hour or two during the day, and then I'm reasonably active, inside, outside the house. I started to walk outside the house today. Make sure I keep ice on my, to keep the swelling down, which it is. So I follow the recommendations fairly closely. It depends on the individual a lot. The understanding that I have of it is probably 1 to 2 weeks. I should be doing very well. Because even now I can walk around and So the other part that will happen, what Scott this physiotherapist said to me is, what will happen, and I believe that too, is that all of a sudden this new mechanical knee is now part of your body, and all of a sudden one day it will say click, and now it's part of you, and all the motion is like normal, and I already feel that to a certain extent today, this morning I had it to a certain extent, yesterday, where I'm walking and I know I'm walking, I'm walking like I'm normally walking, and and I expect then, if you ask me a week from now, 3 weeks from now, that there would be no pain. I believe that I will have no pain, and secondly, I will be able to do more than I was doing before. Yeah.